हेलो एवरीवन। सो 22nd मार्च यानी कि आज वाज अ बिग डे फॉर ऑल ऑफ अस। सो ब्रेकफास्ट करने के बाद हम फटाफट रेडी हुए और भागे कॉलेज की ओर। रेडी होने में आज थोड़ा टाइम लग गया था। उसके बाद हमने एनाटॉमी की क्लास करी एंड सच बताओ तो एनाटॉमी की क्लास करते करते बस एक ही चीज़ सोच रहे थे कि कब वो समय आएगा। उसके बाद हम रेडी हो गए प्रोग्राम के लिए। सो आज हमारा वाइट कोट सेरेमनी रखा गया था हमारे कॉलेज के द्वारा और फाइनली हमारा ड्रीम का एक पार्ट जिसका हम वेट कर रहे थे वो सच हो गया। काउंसलिंग की प्रोसेस थोड़ी लेट तक चली। उसके बाद हमारे कॉलेज में बहुत सारे इंस्पेक्शंस होने लगे। सो ऑब्वियसली हम लेट हो गए थे क्योंकि हम 5 मंथ्स के बाद सेलिब्रेट कर रहे हैं इस चीज़ को। बट कोई ना, मज़ा तो फिर भी आ रहा था हमें।
Good things for the society. You need to build up your brand. A lot of things. The journey never stops, and to those that you need to update. So that's why I was saying it's a journey, not a destination. And when I'm talking about journey, you must be thinking about your childhood. Sometime you would have traveled with your parents in a train. When you look into the window, you see that scenes changing. Probably you may be getting some flashback like that. When you say it's a journey, the scenes keep changing, right? And sometimes these scenes change very rapidly, and that's very much true for your profession that you have chosen. I meant even the scenario will change in no time, and that's why you expect the unexpected. So you need to have that sixth sense in your mind that can be developed by inculcating certain skills. That's why William Osler once said, the famous physician, he said there are a lot of things named after him, Osler nodes and so many things. Medicine is a science of uncertainty and an art of probability. This is one of the famous quote by William Osler. Our ability to appreciate the context, employ the critical thinking and make sense in these situations. And for that we need to develop certain skills. And the skills will not come from the books alone. It comes from how passionately you have worked in your ward rounds, maybe in this. The journey starts with the knowledge that you get as a basic science in physiology and anatomy, based on which you build up your other skills. That's obvious in any field. Knowledge, I mean, you read from the books, you obtain knowledge from listening to the class, listening to the experts. And mastery means by skill developing, maybe a simple skill, maybe very simple, putting a catheter or whatever be the skill. You be the master in that. Second commandment is commit to lifetime learning. Learning doesn't stop in medical field for sure. As I said, things which are yesterday are gone today and it will change. Third thing is inculcate ethical conduct. Now why I am bringing it as the third important commandment, because if you understand today, NMC has been observing that ethical values in the profession are dropping. That's why they have started what's called ATCOM. You have heard of that?
Yes.
Attitude, ethics and the communication skills. So if we were not dropping, then probably this was not required. Develop teamwork. You should be very, very careful in choosing your peers, your team. If you have somebody among them, a boy or a girl, he wants to relax. Okay, now I am out of control by parents. I'm here, I can do anything. I think you leave him or her. That's not the teamwork you have to build. You build a good team by which you can learn. Exude positive attitude. Positive attitude has to come sometimes within, but you can develop it over a period of time. So exude positive attitude. The sixth commandment is know your limits. You may be good in something, you may be bad in something or average in something. Listen to your colleagues, listen to your friend. Probably he or she may be better. And learn from that person and seek help when needed. It's almost the same seventh commandment. Know your limit, seek help when needed from that person. Be respectful and courteous with the peers and colleagues. This is very, very important. See, if we are not respectful, we don't get respect in return also. So that is also very important. Then, this is also very important, I felt, which is the ninth commandment, taking self-care. I see this when the exams come. A month before, I was telling about change of scenario of the students change. I know it is tapasya, but boys, you don't need to look like sages when before the exam. Isn't it? You all develop beard, no shave. And girls, you don't need to look like zombies. A day before the exam, you see them wandering, how our exam going, girls. You can identify easily. So you don't need, that tells, in the last 1 year, you have not planned your journey well. It only tells it. It's not required, I tell you honestly. I did that mistake, biochemistry examination. Madam is here, okay, yeah. I did not, 24, I didn't sleep after physiology paper 2. I went for the exam and I said, okay, after that I have 4 days before the practical. I didn't sleep and studied very hard. I was a so-called studious student those days. But then I did miserably bad. I didn't even get pass mark. Fortunate that the kind examiner gave me some additional mark, I passed biochemistry because of that. Then I realized what a mistake I have done. You don't have to do that. Medical science is not required. It doesn't deserve, you don't deserve to be looking like that. And finally, the 10th commandment is cultivate empathy, compassion, and kindness. As I said, if it was financial is the only reason why you are entered, you have come to your own profession. I told you this is a profession, gives you enough money, no doubt. But at the same time, you need to cultivate this empathy, compassion, kindness, which makes you much different than others. As you get deeper into the profession, you will no doubt hear grumbling about where the direction this medical practice is going. People are already commenting on us, the medical profession. You have become commercialized. You have become unethical. So, in fact, the recently one shloka also has come out. I'm not sure whether you have heard of this shloka. Vaityaraja namastubhyam, Yamaraja sahodaraha, Yamaha tu harati pranam, Vaityaraja dhananisha. You are elder brother of Yamaraja, the lord of death. Because Yamaraja takes away only life. You takes away life as well as money. So these are the words we are listening. So why I am talking about is, it is primary duty of the current generation of students and also physicians like us, not only to provide the care for the ailing patients of ours, but also to enhance the reputation of the physicians by removing any bad perceptions that the public may have.
I, being admitted as member of the medical profession, I solemnly pledge myself to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude which is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets which are confided in me. I will maintain by all the means in my power the honor and the noble traditions of the medical profession. I will treat my colleagues with utmost respect. I will not permit considerations of religion, nationality, race, party politics, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life from the time of conception. Even under threat, I will not use my medical knowledge contrary to the laws or humanity. I make these promises solemnly, freely, and upon my honor. Thank you.
इतनी अच्छी स्पीच सुनने के बाद और रिफ़्रेशमेंट लेने के बाद हम लोगों ने बहुत सारे फ़ोटोज़ खिंचवाए एंड उसके बाद हमारी कम्युनिटी मेडिसिन की क्लास थी तो हम वो अटेंड करने चले गए। ऑब्वियसली मन तो नहीं कर रहा था क्लास करने का, बट इम्पॉर्टेंट क्लास थी तो अटेंड करना पड़ा। एंड उसके बाद जिन बच्चों का क्विज़ नहीं था वो हॉस्टल वापस आ गए एंड जिन बच्चों का क्विज़ था वो वहीं पे कॉलेज में 1:20 PM होने का इंतज़ार कर रहे थे। सो हमारा दिन तो बहुत ही बढ़िया गया। सो थैंक्स फॉर वॉचिंग।